And thanks so much for joining us for this special presentation on CBS News Bay Area. I'm Gianna Franco. Today, we're shining the spotlight on the issue of mental health. We'll be joined by several Bay Area health professionals to talk about the struggle that so many are experiencing and the resources that are available. Now, research from the Centers for Disease Control gives us a glimpse of the suffering. The latest data shows more than a third of high school students reported experiencing poor mental health during the pandemic. 44% said they felt persistently sad or even hopeless. San Jose State recently put the subject on suicide on display. 1,000 backpacks laid out on Tower Lawn, and each backpack representing a life lost to mental illness. One student told us how she thought about suicide in middle school.
Yeah, I was really close to it a few times. I think a lot of it for me was just my family. I was lucky enough that they noticed that I was self-harming, so they kind of forced me to reach out for help.
The pandemic, of course, has just made things worse. A recent survey by the Bay Area Council shows 85% of respondents say they're concerned about the impact of COVID-19 on the mental health of children. 57% say they're very concerned. Nearly 80% say they're concerned about the impact on adults. And 59% say they're concerned about a family member contracting COVID-19. And nearly half say they're concerned about personally contracting COVID-19. So joining us now to talk about all of this is Monica Martinez, the Director of Education and Innovation at the Mental Health Association of San Francisco, Becky Fine, Vice President of Community Initiatives at Active Minds, Morgan Eldridge, a clinical psychologist in the Mood Disorders Center at the Child Mind Institute, and Michael Stanton, Professor of Public Health at Cal State East Bay and licensed clinical psychologist. Thank you again, all of you, for being here. First of all, we'll get started here with you, Monica. Can you tell us about the importance of opening up the conversation and the types of services you offer?
Yes, of course. And thank you for having this segment. It is, May, and May is Mental Health Awareness Month. So I really appreciate you guys speaking on mental health. It's really important. A lot of families maybe don't talk about it often. There's a lot of cultural barriers when talking about mental health, but it's always asking just everyday questions. How are you doing? And having that dialogue about mental health is health, and we always need to check on that. Here at the Mental Health Association of San Francisco, we have many programs. We are a peer-run organization, so a majority of our staff is a peer, so they have that lived experience of having a mental health challenge and getting better. And we really show that when we have community presentations. One big resource is the Warm Line. And so we have peers working on the Warm Line, taking phone calls. They're not crisis phone calls, but they're just there to be able to lend an ear or offer resources when people feel alone or feel like they are experiencing a mental health challenge. And with the pandemic, we've been continuing to have increased number of calls, and anything from grief and trauma because of the pandemic, all the way from stress around lifting the mandates. So I definitely want to plug in the Warm Line in case anyone is starting to cope with their mental health and want to talk to someone. The Mental Health Association of San Francisco provides that resource, as well as many support groups and peer one-on-one counseling.
And sometimes that's all you really need, for some people, is to have that voice or someone there at least listening. That might just be, I don't know if you agree with this, one of the first steps in getting help or realizing that maybe there's something going on.
Exactly. Yes. People might just need to have the conversation and then have someone kind of reflect back that they've had the same experience or they understand what they're saying. They're not alone. And so that's why it's so important that this Warm Line, which is, we want people to get to it before they get to crisis, before they ignore some feelings that they may be holding on to too long. And we just want people to know that they're not alone.
And Becky, Active Minds is a nonprofit dedicated to supporting mental health awareness. How do you even start the conversation, whether you or maybe a loved one may be dealing with something? And what are the signs you should look out for if someone needs help?
Yeah, absolutely. So Active Minds is the nation's leading nonprofit working to change the culture around mental health. And actually, one of the programs we offer is the backpack display that you mentioned at the top that was out at San Jose State. And the intention of Send Silence Packing is to really raise awareness, promote action, and inspire hope around mental health and for the sake of suicide prevention and changing the culture around it. And so in terms of signs that we can be looking out for and ways to start the conversation, we really believe that it's about bringing in the conversation about mental health into the everyday. It's about elevating the types of conversations that we're having so that we don't have to, so that it's not a crisis that we're responding to. Rather, we're responding to kind of our everyday stresses and anxieties and challenges so that, when we can prevent it from becoming something that's more of a crisis. However, when we do get to that point, it's important to be looking out for changes in people's behaviors. If we see something that's off or unusual, it's worth it to ask somebody, "How are you doing?" And in a way that we mean it. Not just "How are you doing?" "Oh, I'm fine." The kind of casual conversation you can have, but no, "How are you really doing?" And to for each of us to learn how to effectively respond to that. Active Minds has a powerful tool we call VAR, which is validate, appreciate, refer. So start with validating your feelings, whether or not I can relate with that. What you're going through is real and it's valid. Appreciate their courage. Thank you for speaking up. I'm glad that you shared. It's important that we have these conversations. And then refer them to skills and support, whatever that looks like for them, what's right for them in that moment, and find out from them what would be helpful to you in this moment. Would it be a warm line? Would it be a walk outside? Would it be binge watching your favorite TV show? Whatever is right for you in this moment is really the key to supporting people in having those conversations and supporting people in preventing crises from happening when it comes to people's mental health.
And you hear of stories, you hear of, in the news and conversations, but, Becky, when we do see those backpacks just scattered across the lawn like that, it really is a powerful message that you just never know how someone's feeling.
Yeah. And it's so important that we not assume that we do. Mental health doesn't discriminate, and it affects all of us. We know that the vast majority of us will experience a mental health condition at some point in our lives, whether or not we know it. And being able to have these conversations, and for all of us to see ourselves as part of the conversation. We all have mental health, and like we heard from Monica, it's as important as our physical health, and they go hand in hand. They're not separate. We need to treat that accordingly.
And it's not just adults, it's children. So Morgan, how do you approach the issue with younger kids if they may be struggling themselves, or if someone else in the family is dealing with it and the child may benefit from talking to someone or for themselves?
Yeah, that's such an important question. And I think to echo, what Monica and Becky have shared, I really, attempt to treat mental and emotional health as we do physical health. So generally, for people, talking with our kids about emotional topics such as their mental health can sometimes be uncomfortable. Sometimes this is, due to the stigma that's involved around mental health, or even just a lack of information and how to, talk to kids or adolescents about these challenges. And so the advice I typically give to parents and families and other adults working with children is, make an analogy to a medical problem. Children often hear about their medical problems or medical problems within the family, especially around the pandemic. We've talked a lot about physical health and medical problems. And so, I think that they're capable of understanding these concepts, and we can break it down, similarly to if we have asthma and these are our symptoms and this is how we take care of ourselves. It's no different with mental health. And similarly, I encourage people to really give kids concrete explanations. Sometimes it's our own discomfort that leads us to, being kind of ambiguous and not sure what to say. And we don't want to say the wrong thing, but the kids are really intuitive, and giving them concrete explanations can be really helpful. And, just describing for you as an adult what's going on emotionally, how our thoughts and our feelings and our behaviors are all really connected. And similar to Becky, listening and validating is so important. We want to make sure, we're really giving them a space to open up about what's going on for them and however they understand it, and letting them know your experiences are valid, and just keeping the conversation frequent, making sure that we're not just, oh, how was your day? And kids are like, fine, good. That we're really leaning into having frequent conversations and opening up the space for them to ask their own questions in their own way.
I think that's a very good point, because as a parent, that's the first thing you say when I pick my kids up from school. How was your day? How are you feeling today? And it's really just more of a surface conversation at first. But I think one of the things I think about is I don't ever want to make them feel afraid or nervous to really share with me, if there is something going on. What are some of the things that you can do to sort of, bring that out in a kid, or to make them feel comfortable to have those conversations?
Yeah, that's so important. I think, part of it is continuing to ask questions. So to dig a little bit deeper into, what does fine mean? Tell me some highlights about your day. Tell me some things that didn't go so well that you wish could have gone a little bit better. Asking some additional questions. I also think just increasing, in general, their like emotional literacy by, as adults, being able to describe what's going on for us. So maybe I reflect and say, I had kind of a tough day at work, and I knew that it was tough because I felt kind of tired, and, I was feeling a little bit sad because I got this email that I wasn't expecting. So again, just to model for them, this is how we share our experiences, and that, just letting them know that adults experience those things too. And it's not just their experience alone.
That's actually very good advice. I think that's very important that you shared that. Michael, we'll move on to you. What is the main advice you have to help in those moments when our minds are so busy that it's just kind of hard to, understand or share those feelings that feel overwhelming?
Yeah, as a clinical health psychologist, I would be remiss if I didn't mention that, just like Becky had mentioned, our mind affects our body and our body affects our mind. And I think one element that people often forget is the importance of physical health as well. And for example, we at our school, and talking to other parents of students, have found that, maybe that people aren't getting out as much or getting as much exercise as they normally had before. So I definitely recommend, even just going outside and walking around the block. It doesn't need to be a marathon. Just whatever you can do is shown to really improve your mental health. In addition, good sleep. So making sure people get to bed on time, and making sure you put mobile phones away and try to really get that restorative sleep. And then also diet, eating good food, whole foods. There is a relationship between fruits and vegetables, whole grains, and mood. And so one thing I definitely tell my patients, tell my students is, in addition to, you definitely want to find help and talk about what's going on in your mind, but also taking care of your body is an important part of the picture.
And I think that's important. Sometimes just taking that break, we all sort of need a mental break or a mental health day. That's something we definitely need to do, because our day-to-day lives, even if you're a kid and you're a student or an adult working, it really can get overwhelming.
Absolutely. I mean, we've been through so much in the last couple of years, right? Just recognizing that we do need a break to just stop what we're doing, put the books away, put the work away, and go for a walk. I mean, we're so lucky that in this part of the country we have weather, pretty good weather most of the time. So, going outside, you could be in nature is even better. There's a relationship between being in nature and blood pressure going down, for example. So yeah, absolutely. Taking that break and being kind to yourself. Like some of my panelists mentioned, it's really, we have to pay attention to those internal signals. And when we feel like we are overwhelmed or feeling like we need that time, it's okay, giving ourselves permission to take that time to go outside and take a break.
Yeah, that is very, very good advice. Well, speaking of, we are going to take a quick break right now. We'll continue this conversation on mental health in just a few moments. Stay with us. Staying with us for this conversation on mental health. Let's get right back into it. Monica, treatment is in huge demand in recent years, especially for conditions like anxiety and depression. So finding a therapist or counselor, let's be honest, it can be a process. Sometimes it can take weeks, even months to just get a referral, and the costs can be sky high. If you're not covered by insurance, what do you do if you can't find one?
Yeah, it is really tough right now. And COVID has really created a lot of isolation and anxiety that has increased, rates of anxiety and depression. I think one suggestion is really connecting to some resources. So, for example, I mentioned the Warm Line of San Francisco, 855-845-7415. Not only do we have trained peer counselors, we also are connected to tons of resources in the community and in California that can connect you to clinics with therapists, as well as help you navigate maybe some insurance issues or how to find someone. Many people go through their insurance providers, but not everyone does have that possibility. So I really suggest just starting by the Warm Line, and they can definitely walk you through connecting you to resources and also lending that support in the moment to help you kind of plan the process. Because as you mentioned, it can take some time. There are some waiting periods. And then there's always the fit with the therapist, right? You might try someone and it works out, but it might take a few sessions to really get to know if you're finding the right person for you.
Yeah, and we'll make sure to get that information up again at the end of the show, because I think it's good for people to have some place that they can call or somewhere they can go in between until they find someone that they can, like you said, if you have a therapist you can mesh with or that works for you. So good info. All right, Becky, I'm going to direct this next question to you. How do you start the mental health conversation in communities, particularly minority communities, where it might not be so easy to talk about?
Yeah, absolutely. I think it's so critical whenever we're engaging in conversations about public health or behavioral health or any kind of community change and culture change. We need to start by engaging stakeholders. We need to start by involving the people that we seek to serve. So, a critical component to starting a conversation, especially in populations where perhaps the stigma is higher or we see these conversations around mental health less easy to access, by engaging with those people and say, what would be helpful here? How can we engage in these conversations? What are the tools and the resources that would be most useful in launching these conversations around mental health, so that we can further support the destigmatization of it? We know that overall stigma around mental health is going down. That's been a trend over the last 15 years, that stigma is going down. But we see that going down at different rates when you break it out by demographics, and there are cultural implications there and demographic implications there. And so it's important to, and we still see the perceived stigma is quite high. So people still believe that seeking support for themselves might be an added challenge, even if the community even if the data suggests that the community doesn't see that as a problem or would support that. And so it's really, really critical to meet people where they're at with the conversation and to aim for kind of bite-sized steps towards it. We heard Mike, I think this is so great. It's important to talk about our diet and exercise and getting outside and all those pieces, and to be addressing that with kind of tiny goals around it. Okay, it might, if a walk is a good thing for my mental health, instead of saying I'm going to go for a 30-minute walk today, let's start with I'm going to go for a 5-minute walk today. I'm going to just get outside and get some fresh air, something that feels really achievable. If I need more sleep, I'm not going to say I'm going to make it, instead of 5 hours, I'm going to get 8 hours every night. Well, maybe that's too big of a goal. I'm going to aim for 6 hours tonight. I'm going to go to bed 30 minutes earlier or something, micro goals that will help us to achieve those pieces. But to your question, it's always important to start by engaging communities in the conversation first and foremost, and in very, very meaningful ways.
Yeah, and just getting that education out there to those communities to know that they have resources. And you're right, good advice, starting small. Sometimes that's all it takes. Morgan, I'll direct this next question to you. What are the warning signs you should look out for, especially in children, to see if they may be struggling?
Yeah, that's such an important question. And I think often, we're not particularly well equipped to be able to identify these things, especially if we're not working in the field, if we're lay people, parents, even sometimes people working with children who aren't in the mental health sector, can sometimes be really challenging. So some of the early warning signs that I look for, especially, educating parents and community members about is, changes in behavior. I think one of my panelists also mentioned that earlier, but if you're seeing a shift in your child, maybe we see, an increase in behavior challenges or a change in their academic performance, or more like, increased isolation or withdrawal from peers or family members. Those are some things to look out for. And really, more generally, we want to make sure that we're looking out for if what is going on with our child is, out of proportion for what we would expect given all the stressors that we've experienced. Because, this time has been extremely stressful and challenging, and our, society was in the midst of a mental health crisis before we had this global pandemic. So I think, keeping in mind that some of the things that we might be seeing in our kids are kind of typical responses to a really stressful situation, and making sure, we're balancing the weights there of what is, typical versus atypical.
Yeah, I can't imagine, just as a parent, how stressful it was for many of us and anyone, and knowing kids were dealing with their own issues as well. Very good information. Michael, what other advice do you have to help deal with mental health issues? I know you talked about going outside and just taking that little bit of a break, but are there other things that people can do to sort of help deal with some of these health issues?
Yeah, we know that to deal with mental health issues, one thing, in addition to what we've already been talking about, finding good, positive social time to be with others has been really challenging, right, during the pandemic. The COVID-19 itself, right, kept us separated. It kept us from interacting closely with other people. And while that was good to keep us safe at the time from COVID-19, it also affected, I think, our social relationships and the connections we had to other people. We know that loneliness, like Dr. Eldridge just said, was already a pandemic before we had our pandemic. And now with the addition of COVID-19, loneliness is really a big challenge, and social isolation. So finding times for example, for your kids to interact with other kids, outside is very safe, even with COVID-19 in general. And interacting with others, with adults, with their friends, family members, finding that time, even if it has to be online, but really taking that time and planning it out. It's I think at a certain point, sometimes people said, oh, we forget about it. We're not going to actually meet at all. It's just too much effort. I understand that, but I mean, really taking that time and planning for really meaningful, positive social interaction can make a huge difference in our mental health.
And I think it's important that you bring up, getting on, even if it's online, to kind of connect with people, because I think a lot of us during the pandemic especially would use Zoom and FaceTime, and that was sort of our interaction just to stay connected. And technology, there's that own set of issues when that comes to mental health and well-being and so forth. So, but in this instances, to stay connected, I mean, that's okay.
Yeah, it's definitely okay. I mean, we know that the closer you can get to real, interaction is probably better. We know that, for example, 90% of communication is nonverbal, and you only get a little box on Zoom, right? It's definitely better than nothing. But if you can, if there are safe, especially now that we know more about COVID-19, being outside, we're very lucky in where we live that we can be outside year round for the most part. Having those types of interactions are really, really helpful and healthy for all of us.
And getting that fresh air. Yes, it is. All right, we're going to take another quick break. Stay with us. We'll be right back. Welcome back, and we are talking about mental health awareness, and this has been a really great conversation, a lot of good information. And I do want to end on one thing here, though, since we've talked a bit about the pandemic and how that's really affected mental health. Do you guys have any thoughts or information on the long-term impact of what the pandemic has done? Anyone have any other advice? Monica, I can start with you.
Definitely. So we are seeing what those long-term effects will be. Right now, we are seeing a lot of unaffordability and, mortgage and economic crisis for families. So that it does create a burden of mental health and stress on a lot of families. Also, we saw technology, really, that was a huge lesson learned, as you mentioned. We went virtual very quickly, but not a lot of people had that connection with internet or even technology. So we're seeing that there's a lot of barriers that the pandemic, brought to light, as well as we're seeing now a lot of impacts when it comes to general mental health, like anxiety, isolation, loneliness, and as well as economic issues now with homelessness, rent, mortgages, and economic concerns that are stressors. We don't provide, direct financial support, but we do, again, suggest reaching out for help, whether it's, navigating resources or getting connected to any mutual aid support. And we've seen that a lot of young people are also seeking services online. And there are a lot of virtual wellness centers being planned, especially by us, to really connect young people, because there is that anxiety to come back out and socialize again. But we want to create those spaces available online, and it's important to have that technology available.
Definitely. We've all been dealing with so much. Becky, any final thoughts for you?
Yeah, absolutely. So, we know that the pandemic has exacerbated mental health challenges. And another layer is that it has elevated conversations and uncovered the conversation in really important ways. And I think something that I'm so struck by is that youth and young adults today, more than any generation before them, are willing and able and ready to have these conversations about mental health. They have the language, a lot of them have the language around it. And a lot of, I think, an interesting, important next step is parents and teachers and mentors and people who are adults in the lives of these young people, to not shy away from it based on our own ideas of stigma or concerns or kind of barriers that we may have in place around it. So I think my parting words here is to engage in these conversations and engage in the resources. Active Minds has a lot of tools and resources to help kind of, how do we broach these conversations? How do I kind of stop being afraid to get into this conversation and know that most likely it's going to be a welcomed conversation to the people that you start it with, especially youth and young adults.
I hope people who hear that really take that to heart, because I couldn't agree with you more. Morgan, do you have any final thoughts?
Yeah, I think, to echo what Becky and Monica have shared, prior to COVID-19, our country was in the midst of a mental health crisis, and that's only been exacerbated further. And, the restrictions that were imposed by COVID-19, while preventative and necessary, have lots of social consequences and have created lots of subsequent stressors. So, like Monica mentioned, job loss, financial stress, food insecurity. And I think it's important and, to mention that this has disproportionately impacted people of color and these families and these children. So, I would encourage, similarly to Becky, like to keep the momentum going, to keep moving forward and having these important conversations, and to, if you have access, Childmind, to internet, Childmind Institute has a lot of, online resources, very like parent friendly handouts and things that families can look at to give them general information about mental health and how to help them facilitate these conversations. We actually more recently have the California Healthy Minds Project. So we actually have resources online for caregivers and educators, and it's a series of free evidence-based videos to help families, access some of this information.
And I think that's important, because when you approach things as a family, for someone who might need that love and support might feel that more, knowing that there's people who love them and care for them. So thank you so much. Michael, I have a list of things: getting fresh air, getting more sleep. Is there anything else you'd like to add?
Yeah, I think that, from the research, we know that, for example, during the Fukushima disaster in Japan, that people were very resilient right at the moment. And when they tracked those people over time, they realized that they experienced more mental health challenges actually 2 years, 3 years after the disaster. And I think we're going to see that, continue in our own society as well. And so all the techniques that were offered by the panelists have been fantastic. I do want to remind people, again, exercise, good sleep, and good diet, that can go a long way. And in addition, if people are finding that they really just can't handle it and they want some extra help, there are professional, resources available. If you have insurance, then contact your insurance provider. That's probably the easiest way to do it. There are other resources, like Monica had mentioned, through her line. Sounds like a great resource. And feeling free to reach out, because you don't feel like you need to do this all by yourself. There are resources out there and people who can help you with this.
Yeah, that is very important. It's very important that we've had all of you here today, and thank you for sharing your time, your expertise, and your knowledge. I really hope people take this to heart and pay attention, because it is a very important thing that should be discussed, and we shouldn't be afraid to have these conversations. So Monica Martinez, Becky Fine, Morgan Eldridge, and Michael Stanton, thank you all for joining us today. We really, truly appreciate it.
Thank you.
I do want to share some information. If you or someone you know may be struggling with mental health, here's a list of some resources that are available. We talked a lot about these. The Warm Line, for example, that is open 24/7. The number is 855-845-7415. You can reach the National Suicide Prevention Lifeline by calling 800-273-8255 or even texting 838-255. And you can reach the crisis text line by texting HOME to 741-741. And again, we thank you so much for watching.